Hey guys, it's Dave. Coming at you today with a syndrome that is very rare. I want you to realize it is very rare. It was brought up at one of our TikTok lives, but it's post-finasteride syndrome. Unfortunately, it's not really recognized as a medical condition. However, the NIH now has it listed as a rare disease. Finasteride is a drug. It's a 5-alpha reductase inhibitor, big terminology out there. It's used mainly for benign prostatic hyperplasia or an enlarged prostate, along with another drug called dutasteride, which is in the same class. And just so you know, they have seen the same kind of effects with both drugs, but mainly it's been finasteride. One of the reasons they believe that is finasteride is also used for something else, alopecia or male pattern baldness. It's generally used in a lower dose. It comes as a 5 milligram and a 1 milligram tablet. Generally, they use the 1 milligram tablet for that. However, you can use the 5 milligrams as well. It also comes topically in solution, and you can have compounded creams as well for the baldness indication. That's why they believe that we're seeing a lot more of this now, because you have websites out there like Hims offering this drug for people that don't go in to see the doctor, but they get it online or they get it through a telehealth visit. And so we may be seeing more of this with finasteride than dutasteride, which is not used for that. So be aware of that. In one small study, unfortunately, there is no cure for this disease. But in one small study where 10 cases of post-finasteride syndrome were reported in New Zealand, 3 men actually recovered from it over a period of years. Not really good, that's only 30%. 56 countries around the world actually recognize this as a risk, and they put warnings out there for this. Unfortunately, the United States is not one of those. There have been 19,660 reported cases worldwide. So when you break it down, honestly, if you look at men with baldness, with BPH, that is a small amount of cases. But also remember, not everybody is reporting this. So if you do have some of the symptoms that I'm going to describe, I want you to make sure that you have a discussion with your provider and do report it, because that could be part of the problem is men are not reporting this like they should, okay? Now, some of the things that you can see with this syndrome, mainly we're looking at sexual symptoms. So, decreased or complete loss of sex drive or libido. Peyronie's disease, where you've seen the commercial, you get the bend in the penis. That's something that can be caused from this. Erectile dysfunction or impotence. Now, that's kind of tough because as we age, all men have decreased sex drive and issues in some degree with that. So it may not be due to post-finasteride syndrome at all. So you want to look at more than one of the things that I'm actually telling you about to see if you actually have that. Decreased semen volume and force. A loss of interest in sex altogether, or decreased pleasure during sex. Scrotal shrinkage and numbness can occur with this, as well as penile shrinkage and numbness. So if that's something that's going on, that's kind of different, and that would be something that you definitely would want to look at for this. Other than that, there are some physical symptoms that you may see. You may see some breast enlargement to the point of like female breast enlargement. That's something that can be seen. Chronic fatigue, listlessness. Well, hello. As we age, we all get fatigued more often. So again, that's something you want to look at combining with other symptoms that I mentioned. Tinnitus, ringing in the ears. Melasma, which are basically sunspots or age spots that happen around your body. They're darkened circles or splotches in your skin. Weakness or muscle atrophy. Again, that's something you want to be aware of. You're looking at more than one symptom because after the age of 40, everybody loses 10% of your muscle mass yearly if you don't do something about it, which is why it's so important to exercise and include a weight regimen in that exercise. Increased fat deposition around the body, mainly in the stomach area, and increased BMI. Again, you see that naturally occurring. It may have nothing to do with this. A reduced HDL cholesterol or good cholesterol is seen, as well as increased triglycerides. So again, you can see that with age, so you want to look at all of this. The attempted suicide has been seen and completed suicide, unfortunately. That is something, especially if you have a history of mental health issues with you or your family. If you are prescribed dutasteride or finasteride, have a discussion with your healthcare provider about this, because that is something very serious. The other thing is mental health. It can affect your mental health. You can have a slowed thought process. Your memory and recall will be impaired. Insomnia, anxiety, an increase in anxiety, an increase in risk for depression, and as I mentioned, suicidal ideation. So if you have any issue in your family history, definitely talk to your provider about this, because although post-finasteride syndrome is rare, it is more common in people with mental health histories. So you want to make sure that discussion is had with your provider. Something else that can be seen along the mental health side is impaired problem solving and decreased comprehension. Again, like I said, we all see this as we age, whether you're a woman that would never be on finasteride or a man that isn't on finasteride. So group all this together. If you're seeing a lot of them in you, have a discussion with your provider. As I said before, there is no cure. However, you can get off of finasteride. You can use something like tamsulosin, which is another drug not in the same class that helps to reduce BPH. It will not do anything for male pattern baldness or hair loss, though. Be aware of that. Terazosin is another drug in there as well that can be used to decrease for BPH. Okay? Now, they have found, last year, they found that PEA, it's a short acronym for a very long term, has potential to help with mood and anxiety issues caused from finasteride. You can get it in some natural supplements, have it in there, but it's mainly seen naturally in egg yolks and peanuts, PEA. The other thing that they have found linked to post-finasteride that you can do something about is your gut. It messes up your gut microbiome. So guess what? We already know naturally, diversification of your diet, staying away from processed foods, adding fiber, adding fruits and vegetables, and a lot of different types of fruits and vegetables, and a good probiotic will help that out.